Usefulness of renal biopsy. Renal biopsy is useful in understanding the glomerular disease and tubulointerstitial disease, mostly inflammatory diseases, manifested by proteinuria, hematuria, hypertension, sedimenturia, azotemia, edema. So they are useful in the pediatric renal diseases like nephrotic syndrome, where in difficult cases we see the podocytopathy. And is electron microscope diagnosis basically. And minimal change is commonest. It is the diagnosis by exclusion, the light microscopy and immunofluorescence. So, electron microscopy podocyte change, you decide the prednisolone, you decide the therapy with the CNI. If prednisolone is found to have resistance, and then you have other options, the rituximab, triple therapy, and a combination of three drugs, and extended therapy in other resistant cases. That means it helps in therapeutic decision of the your glomerular disease. It also decides in the acute and chronic tubulointerstitial nephritis, where also you decide you give immunosuppression, the prednisolone and others, when you have methylprednisolone and other medications, cyclophosphamide and so forth. You also diagnose by histology IgM nephropathy, IgA associated nephropathy, IgA nephropathy, and the C1q nephropathy. These are the rare diseases, but they have difficult course and nephrotic presentation. At times, good amount of times, I should say, that progress to CKD. So thereby, the knowing these diseases by the biopsy is essential. In nephrotic presentations, the PSGN is by far the commonest, and other infections, yes, they have their unique histology. So humps and others, they are characteristic of the PSGN, though we do not do the biopsy and acute post-streptococcal GN because the course is most of the time uneven full recovery. So why you go for an invasive procedure? But when you have some atypicity in presentation, you should go for the a biopsy that will guide the your histology and ultimate diagnosis, and thereby therapy of that particular gene. So doing the histology, the biopsy and knowing histology is essential. And it also helps in the diagnosis in the transplant rejection cases, antibody mediated rejection, cellular rejection. They are known by histology, and we have to go to biopsy. CNA toxicities, the acute and chronic tubulointerstitial nephritis of cyclosporin and tacrolimus and voclosporin is now known by your unique histology along with the trough levels of these drugs. So, and there, the therapeutic options for you is to withdraw the medications or change to another safer medications. So, there are plenty of ways that biopsy helps. At times, the good amount of fibrosis is there. Suppose a GN turned to fibrosis, and most lean security parameters are prominent, so you do not derive any benefit by immunosuppression. In those cases, you have the decision from the biopsy. Thereby, biopsy is useful in good amount of cases of renal diseases.